Hey there, it's Dr. Jim. I've been doing a lot of research, a lot of reading on burnout and resilience. And since I'm a gerontologist and I work in senior care and have for about 32 years now, one of my main concerns is nurse burnout and resilience. So that's my topic for today. I have a great article if you'd like to read it or just watch this video and share it with your colleagues, because I think a lot of nurses are either stressed out, some are burned out across America. Nurse burnout and emotional exhaustion are serious threats not only to nursing staff themselves, but to the patients that they care for and the organization as a whole. In some studies, and this is very high, I can't believe it, over 50% of nurses report that they experience moderate burnout and pessimism. It's like, they're like, why do I keep doing this? This is not good for me. This is not the best job. I need to move on, something like that. While other nurses bounce back and become more resilient themselves, organizations can strive to make the workplace a healthier and more positive place. So what is burnout? Burnout is a very harmful physical and emotional state that's generally characterized by just three classic symptoms of exhaustion: depersonalization and decreased personal accomplishment. When people feel that, I'm physically, emotionally exhausted. Depersonalization means I'm just an object. I don't feel whole. I feel like my head has popped off and I'm just floating around doing the same old routine every day. And personal accomplishment is like I've hit a brick wall. I need to do more. I can't do more. I want to go to the next step. I can't go to the next step. Many nurses may experience burnout by providing the best care they can over long periods of time. So burnout is in fact a byproduct or a product, direct product, of giving phenomenally great care, but it just happens. Eventually they become cynical, or they can become negative about being a nurse. Burnout can also cause a cascade of professional difficulties in the workplace, in communication, teamwork, attendance, and performance, as well as personal problems, including a lack of motivation, feelings of guilt, and poor self-esteem. So what about resilience, psychological resilience? Can it help? I dug into the research, academic, medical, nursing, and more. A much researched concept in nursing is actually resilience. And it's thought to be a personal strength that can help nurses bounce back. It involves the individual's ability to overcome adversity and decrease stress, improve coping and adapting to various situations that will arise. It can be captured by this following statement: what doesn't kill you makes you stronger. That's resilience. While resilience skills can be learned by oneself, it's a greater benefit when organizations and companies develop resilience training for their staff. So what does that look like? Let's face it, and let's be honest, okay? Resilience is necessary because burnout is an ever-present and concerning issue for nurses and other healthcare professionals. For companies and organizations around the country, they should consider developing a structured resilience skills training program and then offer it on a regular basis. One element of such program is to understand and be able to measure resilience, because you can't change what you can't measure. And burnout as a part of the corporate employee wellness program. So if you have a wellness program, is resilience training a part of the program? Another important piece is to assess the workplace environment and to identify factors associated with both stress and burnout. Some things to consider for an effective resilience training program can include the following: your staffing levels, communication, problem solving. Those are very important things. Conflict resolution, debriefing after traumatic, terrible events have taken place, recognition and reward, your caseload, and leadership. Is leadership creating more stress? Is leadership helping to buffer and manage stress? Well, I hope they are. My name is Dr. Jim Collins. Thank you for taking some time with me. I hope you come back soon. My topic has been nurse burnout and resilience, and I'm going to keep digging for more answers to a lot of problems that we have in healthcare and in senior care. Well, I certainly hope you enjoyed the video, and thank you very much for your time. If you'd like more information about a great online learning management system with the most wonderful support, best in class support and partnering, please look for the link to the website in the description. You'll love what you see.